You are watching Radicon. So what can radiation do and what are the radiation effects on human body? A decent radiation exposure to eye can cause cataract. Direct radiation or radioactive iodine can cause thyroid cancer. Inhaled radioactivity such as radon-222 in gas form is known to increase lung malignancy. Ingestion of radioactivity can cause stomach cancers. Direct radiation to gonads can result in sterility. A direct radiation exposure to skin can cause burns, redness, necrosis, or even skin cancer. Radiation therapy to bone marrow can result in marrow-aplasia, leukemias, and a range of immune disorders. This slide shows radiation effects related to the dose along a spectrum. You can see first three lines are in red, which are extremely dangerous doses of radiation. A radiation dose of 10,000 millisievert can result in death within days. A radiation dose of 5,000 millisievert or 5 sievert can result in death of 50% of exposed population within 30 days. Hence, we can say a lethal dose LD5030 is 5 sievert. Doses around 2 sievert or 2000 millisievert result in acute radiation syndrome. Amber region shows mid-range doses where each sievert or 1000 millisievert contribute to 5% increased risk of cancer. In Fukushima accident, radiation doses were approximately 400 millisievert per hour, which would have resulted in acute radiation syndrome in 4 to 5 hours. Doses above 100 millisievert are believed to be threshold for increased risk of cancer. Compared to these high accidental doses of radiation, acceptable occupational doses are much smaller. Yearly limit for nuclear workers is 20 millisievert and for air crew it is 9 millisievert. Full body CT scan is equivalent of 10 millisievert and a mammogram approximately 3 millisievert while a single chest X-ray is 0.1 millisievert. International Committee of Radiation Protection ICRP has been the central body for research and challenges in acceptable dose limits for radiation workers. As we can see how acceptable dose limits have changed in last century from 500 millisievert in 1930 to only 20 millisievert in 1990, resulting from the better understanding of radiation, its hazards, and protection principles. Coming on to the main part for radiation protection in medical imaging for those who are working in diagnostic radiology. This illustration describes in detail radiation doses for various examinations in their absolute dose as well as multiples of dose for a chest X-ray. Right at the top, there is an arm or anchor X-ray with 0.05 or 0.1 millisievert, which is equivalent of one chest X-ray. A lumbosacral X-ray highlighted in first red line can impart dose of approximately 2 millisievert, equivalent of 43 chest X-rays. Barium meal, highlighted as second red line, can cause radiation doses of approximately 3.6 millisievert, equivalent to 76 chest X-rays. Barium anima can be equal to 7.1 millisievert, which is equivalent to approximate doses of 154 chest X-rays. Doses for few other examinations are also shown.
This video is presented in collaboration with Radicon Institute of Radiology. You are welcome to subscribe to our YouTube channel and click on the notification bell for updates. For more modules in Radiology CMEs, please visit our website www.radicon.org.